A lot of times people come in asking about FUT versus FUE procedure and which one is better or worse. And I don't say one is better or one is worse, but one patient may be a candidate for one versus the other. So a patient who would be a better candidate for an FUE procedure, follicular unit extraction or excision procedure, which is what I use the ARTAS IX robotic system for, is someone who may have a very tight scalp. There's not a lot of laxity to be able to remove the strip. Somebody who wears the hair very short, where they wouldn't want that linear scar to be noticeable or visible. That would be an indication for a robotic FUE procedure. Somebody that's very active and that wants to get back to activity very soon, because after approximately 10 days, the grafts that have been transplanted are permanently in place. And then at that time, those patients can go back to full activity. There's really no restrictions. So those patients, for the most part, would do much better with an FUE procedure. For the FUT or the strip procedure, there are patients who are better candidates for that procedure. Someone who wears the hair longer where the scar is not an issue, or somebody who has a very lax scalp and is very mobile, which may not be as good of a candidate for the FUE procedure, but that patient may be a better candidate for the FUT or the strip procedure because of the mobility and the laxity that they have of their scalp. Or someone that's had a previous FUT procedure already and still has the laxity of the scalp because they already have that linear scar. And so when you do a second FUT strip procedure, you're removing the old scar and just replacing it. So you're not adding any more scarring to their scalp. So, those patients would do better with an FUT strip procedure. So I do both procedures in my practice, the FUT strip procedure as well as the robotic FUE procedure. And I see each patient, I evaluate them, I examine them, and I talk to them honestly which one would be better for them. Some patients may be candidates for both, and we discuss that. Or some patients may be candidates for one versus the other. So we have a full in-depth discussion about each procedure, and then at the end of the consultation, we would decide which one is better